is. And to lose a person of his caliber is really a sad loss in, on any advice being given by him. If you look at the way that he conducted himself the past year, the how people listen, the calm manner that he gets out there and state his point. It is just amazing. There are few Prof. Salim Karims around the world. From SAMA side, we've got the greatest respect for him. And yes, his shoes will be filled by Dr. Mlisani and Prof. Mlisani and Prof. Jacobs, and they are also great people. And hopefully he will not be lost for us. And, I spoke with him recently, and he assured me that if there's anything from SAMA side, any advice that we would like to have, he will still be willing to give advice. But I do understand also his position. I need to make it clear that when you are on these advisory committees, there's no financial gain from National Department of Health. They will not pay you to give those advisories. And a person in his position needs to be everywhere. There's three big maps, and then there's subcommittees. So he needs to be there, and it takes a lot of your time. So according to him, and I believe him, his first love is research, especially in the HIV field. And it got lost. He says he can't carry on like this. There's no time for anything else. All that you do is that you sit and give an advice, and you're everywhere except where you should be.
Now, let's just talk about this projected third wave now, Dr. Coetzee, and looking at where we are and looking at how, this pandemic well over a year ago now, and in terms of how South Africa has responded. And we are now approaching the Easter weekend. There is a talk about the third wave hitting us by the end of this month and early April already. And I'm sure we've learned a lot of lessons. But the key issue here is how proactive is our approach at this point in time?
Not very proactive. We tend to stumble from one crisis to another crisis. If you look at what is happening in the Eastern Cape, it's chaos in the health arena there. There's lots of trouble going on there. Services are not being rendered the way it should be. And remember, the second wave started in the Eastern Cape and then spilled over to the Western Cape and KwaZulu-Natal. So we have difficulty in learning. We know the problems. We know what needs to be done. But there's a discrepancy between know what to do and then the action, to action it, to make sure that it is happening. And also the same story that we keep on hearing is that there's not enough money. Now, if you look at all the legal costs against the various provinces for, in the health sector, and you take that monies and you use it back into the sector, into the healthcare sector, I think you will find that you will have less money issues. But that takes quite a bold decisions to be made. And people need then to be accountable. We surely need to look at where is the money going? Because it's definitely not going into paying doctors or upgrading centers, medical centers, the way it should be. And then we are amazed when we get hit by a wave and there's not enough beds and there's not enough correct people trained for the correct job in the correct wards. Then we say, what now? And I can promise you it's a year later, most of these doctors are burnout, and the nursing staff, the burnout. They just carry on and on and on because there's no one else. There's a lack of staff. There's a lack of there's a lethargy under the people. And on top of it, they didn't got any increases in the salaries, but you are expected to do the work. There's not enough equipment. There's not enough willpower to fix the stuff. So maybe I should just keep quiet. But for me, it just feels as if we are stumbling from the one crisis into the next.
Well, yesterday I spoke to a Professor van Grienen, and she mentioned exactly the same thing that you are talking about in terms of doctors, in terms of the burnout. And obviously, this is not about a lack of skill or expertise, because we've got the expertise in the country. And I'm sure, Dr. Coetzee, we've got sufficient data. Sorry about that. We've got sufficient data to track where we are as far as this pandemic is concerned, and to be able to make the right decisions.
Yeah, we do have it. South Africa's got one of the, the best scientists, the best researchers in the world. I've worked with them. I'm still working with them, and again, they know. But as a scientist and a researcher and heads of departments and clinical expertise that we all have, it's not helping. There's a political problem with appointments, with what are we going to do? How are we going to fix the problem? So it becomes a political way of fixing the problems, and we're not fixing anything.
Now, just looking at the vaccine rollout, because, just your thoughts and your views on where we are on the vaccine rollout, because, again, there are certain concerns that have been expressed that we're actually running behind schedule.
Yes, we are running behind schedule. Remember, this is still not really a vaccine rollout. This is still falling under an open label implementation study, phase 3B. So we're still waiting for the vaccines to come into the country, the real vaccines, so that we can start with a real rollout as being, envisaged by everyone out there. But here I need to come up for the government, because what we have seen is that the manufacturers are the ones that put a lot of demands in, they're not going to tell us how much and when they will send it. They will tell us, you will receive 600,000 vaccines in the second quarter. And that's it. And you can try your utmost, but I know that National Department of Health is working very hard behind the scenes to get a time frame. But this is not possible at the way that these manufacturers are operating, and it's across the world. So for in that way, I need to come up for them. But it's still going to be a huge problem going forward. If we don't know when the vaccines is really coming in, quarter 2 is 3 months long. So, and if manufacturers are not willing to commit on a date, it becomes extremely difficult, and it might jeopardize the rollout. Also, I'm very worried. The flu vaccines has not been yet distributed or been available in the private sector. The public sector was telling me that it's already available there. So we are on all fronts running out of time against the race of when winter is going to start, and also against the Easter weekend.
Well, let's see. We have heard about the Command Council. Obviously, they have already started the meetings, and I'm sure we will be getting some announcements very, very soon as to how we are going to be looking or approaching this third wave before it hits us, in terms of the regulations, lockdowns, and what levels, and the like as well. But it's always, Dr. Angelique Coetzee, we thank you. We do appreciate your time, taking time off your busy schedule, coming on and talking to us here at Salam Media on News and Views. All the best to you.
Thank you so much, and the best to have a good day to you and to all your listeners out there.
Dr. Angelique Coetzee, Chairperson of the South African Medical Association.
Penny Appeal's Education First campaign helps children to get access to quality education.
I'm 14 years old. When I grow up, I'd like to be a scientist.
We believe every child belongs at school.
And we want education, a better education.
Learning and dreaming their way to a better future. With your help, we can provide classrooms, desks, stationery packs, and school shoes. Help make these dreams a reality. Visit www.pennyappeal.org.za or call 031 1100 573. Penny Appeal. Small change, big difference.
Are you looking to be inspired, uplifted, and empowered? The Mid-Morning Talk Show with Nafisa Dango is here to showcase positive inspiration that will entice you to change your perspective and uplift your well-being.
The first step to recovery in any kind of situation.
We're trying to create critical thinkers, critical leaders.
What gives me passion? What brings purpose?
Change your mindset, reach out and uplift those in need.
Is there happiness in what you're doing? So are you just...
So we need to use slavery in the context of today's terms, and
sometimes we don't venture beyond our own spaces. We only stick to what we are used to.
Tune into the Mid-Morning Talk Show on Thursdays between 11 and 1 p.m. to be enticed into different spaces where we uncover the true meaning of love and positivity.
DoosieMed Medicine Depot Retail Pharmacy and Emergency Medical Depot. Conveniently situated in the DoosieMed Medical Center, Corner Burger and Boshoff Street, Pietermaritzburg. We provide safe, affordable and convenient medical facilities. Open till 10 p.m. every day of the year. We have a full house clinic that operates from 2 p.m. to 7 p.m., which is run by a qualified sister. The clinic offers immunization, vaccination, wellness, general consultation, and more. Call DoosieMed Medicine Depot on 033 3421 DoosieMed Medicine Depot, your pharmacy of choice. Give charity without delay, for it stands in the way of calamities.